Hello to the global cleaning community, and thanks for joining us for this edition of Straight Talk. My name is Jeff Cross. I'm the editorial director of ISSA Media, and today we have with us as a guest Dr. Gavin Macgregor Skinner, who's a recognized expert in emergency management and infectious disease surveillance and response. Gavin, that sounds like a mouthful of what you're doing out there in the world today. Also, Dr. Macgregor Skinner is one of the directors of the Global Biorisk Advisory Council, which is GBAC, a division of ISSA. So thanks for giving up a little bit of your time on this weekend. We're looking at a Saturday work at home, I think, today. So what's going on out there, Gavin? Are you keeping busy?
Yes, Jeff. What I do and what I've been focusing on is frontline worker safety programs. So working in hospitals, fire departments, police, cleaning professionals, people that work in grocery stores, for example, and looking at the engineering controls, the administrative controls, as well as personal protection equipment, respiratory protection programs, but also focusing on how they clean and disinfect and are able to inactivate or kill an envelope virus like the coronavirus.
Well, I imagine your services have never been, well, you've been busy throughout your career, but especially right now with this coronavirus. You mentioned you're working in hospitals. Now, what are you doing in these hospitals? And also, what are you seeing when you see our cleaning professionals, the frontline workers, with their work and what they're doing? Tell us what you're seeing?
So because we're being overwhelmed right now with patients that have symptoms, it's also flu season, it's allergy season. There's a lot of people that actually have symptoms, and also the worried well. A lot of our hospital and healthcare systems are being overwhelmed with so many people. So I help them with the triage. I help them with setting up a system that focuses on hospital staff safety, whereas usually in a hospital we focus on patient safety and treatment. I now focus on everyone in a hospital that could have contact with a person with symptoms, or even come into a room where there could be a high viral load. And that's a lot of training and practice and drilling. So I go in and say, well, what equipment do you have? Well, we have this to protect our eyes, nose, and mouth. Good. Where is the movement? How is equipment moved throughout the hospital? How do we decrease the risk of transmitting a virus throughout the hospital when we move equipment, when we move people? But I also work with the cleaning professional staff at the hospital for when they come out and I ask them, what equipment do you have now? How do you usually clean a room for any patient? And what do we need to do differently? And how to modify those procedures, those standard operating protocols that they have, as well as train them in the equipment they have without saying you need to buy something new, but to actually come up with a plan, a procedure that will decrease the viral load by cleaning and disinfecting by using an EPA registered, approved hospital grade disinfectant for both porous and non-porous surfaces. And then once we write that piece of paper, that's not it. You've got to take that piece of paper, you've got to practice, you've got to drill it, you've got to make it work.
Well, imagine your days start early and go late. When you go in these hospitals and do all of this, which is fantastic. Thank you for what you're doing. How long do you spend in each hospital? Are you mainly at a certain hospital for a few days, or do you move around?
Yeah, so anywhere from 12 hours to 3 hours to 2 hours. It depends on how the hospital is working. So again, hospitals work on shifts. So if I'm in a hospital and I'm setting up a program for one particular team in that hospital or one particular department, I may have to go to other departments, or I may have to wait for the shift to change when new people come into the hospital so we can create that level of consistency of provider safety, as well as that level of consistency of protecting the environment, objects, stuff, equipment, and people from the coronavirus. So I could be there for anywhere from a few hours to many hours, and then usually I spend at least one day, half a day, and I could visit a couple of hospitals. But it depends on what phone calls I get first thing in the morning.
Okay, you're on call, aren't you? That sounds like a busy day for sure. Are you seeing any issues we should talk about with our cleaning staff in the hospitals or any facility? Are there any tips you would have for them that you as you walk through these corridors, you kind of like, ooh, we need to fix that? Anything you're noticing?
Well, in the same, when I go into a hospital and I do my risk assessment of that hospital and I look at their existing protocols and procedures, doctors and nurses don't get trained adequately and proficiently in how to don or put on personal protective equipment and how to doff or take off personal protective equipment. Many of the hospitals that I work in now here in the US have activated their hospital incident command system. When I look at the people that get together each day throughout the day to talk about how serious this emergency is, the ways that we mitigate risk, guess who's not at the table? The cleaning professional staff.
Yep.
So what I advocate in every hospital I go to is one of the ways that we can decrease risk, increase frontline worker safety is to clean and then disinfect appropriately. And so many of these hospital incident command systems now have their hospital cleaning staff on that actual team. And I think that, for me, that's a first in my career. And they're actually to able to express what they need from the hospital administrators to do their job properly, efficiently, and safely. There's a big pressure on hospital cleaning staff in the first place. When a patient leaves, they have to clean the room, turn around the room, so a new patient can come in. That's good when you're doing a clean and shine, but it doesn't work when you're doing a clean and disinfect. And if they tell me we have 20 minutes to clean this room to get a new patient, that's not long enough. So we're now rewriting the protocols, the procedures, and working out how long does it take to clean this specific room, clean and disinfect it to decrease the viral load, to make it safer for the next patient, as well as the doctors and nurses that are going to be working in there.
So even though we're in this crisis with this pandemic, it sounds like when we come out of this, there might be a better understanding and appreciation for what the cleaning industry can do in these situations. So there's that component as well. I'm sure you'd agree that we're learning some stuff here, and that's going to help.
We are, and we're taking more of a team-based approach. In many of the businesses, the organizations, and also the hospitals, there's always a hierarchy. Hierarchical organizational structures don't work well when there's an emergency like an infectious disease outbreak. And it's really important that everyone on the team has the ability to speak up, especially when it comes to working in high-risk environments where there's a high viral load. And we call those hostile environments. So, giving people the ability to speak up, tell them what they're concerned about, but also where we need to do retraining or more training to ensure they can do their job safely. Very cool.
I have a couple questions for you. One was sent to me. It was a question about the equipment we use in cleaning. So in the buildings you're in, they sweep, they mop, they vacuum. They might clean carpet with a portable extractor. Can you tell us a little bit about the contaminants we're dealing with, and are we picking them up appropriately? Could they be going through a vacuum and then released in the air again, or maybe an extractor? What would you say to that?
Again, there's been lots of research studies done on the need of vacuuming in environments where they pick up pollen, bacteria, or even viruses, and then what we call re-aerosolize them, put them back in the air again. If I can talk from my experience in hospitals at the moment, I was surprised when we looked at the floor plans. We started walking through the hospital, the amount of carpet that's in a hospital. And we had to come up with a strategy to decrease the risk of catching a virus if someone had spread virus onto those carpeted surfaces. So in a lot of the hospitals, we've covered them with plastic. We've gone from a porous surface to a non-porous surface by covering up those areas with plastic so we can clean and disinfect those with an EPA-registered disinfectant. What I'm also looking at is, again, it comes back to the quality of the vacuum cleaner machine that you're using, the quality of the filtration system. Newer models, more expensive models do a better job with their HEPA filters and their filtration system. There's always a risk there. But it's also important to note that anyone who's using a vacuum cleaner, how are they protecting their eyes, nose, and mouth? Mm-hmm. So if we know there's a risk of possibly picking up any sort of germ, but especially this virus, and re-aerosolizing it through a vacuum cleaner, are we giving them the right personal protective equipment to protect their eyes, nose, and mouth? And something that I've learned over the last month or so of working in so many different buildings where there's been patients with coronavirus, with carpet on the ground, was that so many people weren't cleaning their vacuum cleaners. And so there's a risk there of mechanical spread. When we vacuum a carpet that has virus or bacteria or pollen on it, there's a chance when we go to the next room, we've actually mechanically moved that with the vacuum cleaner. So I sat down and said, what's your procedure, your protocol for cleaning and disinfecting your vacuum cleaner? Some said we have one, some said we don't have one. So we've now focused on how to clean and disinfect vacuum cleaners, as well as make sure that they're maintained properly so they work properly and as efficiently as they've been designed to, again, decrease that risk.
Yeah, it makes total sense to pay close attention to the equipment. Keep it clean, considering where you're going from one area to another. Thank you for that, Dr. Macgregor-Skinner. There was I believe you received a call from a supermarket or a supermarket chain recently about issues with when someone comes down with coronavirus or COVID-19 in those settings. Do you recall that?
Yes, I do. So I provide a lot of consultancy services. I've received calls from supermarkets as well as nursing homes, assisted living, but other areas where there's high density of people on a day-to-day basis.
Yeah, so when I go shopping, I know I get in line. Usually they say 25 in the store. I went to one yesterday. Beautiful day, so I was in the sun. It was okay to wait. But that's become the norm. You go to a big box store, you go to a grocery store, they stop you at the door and they allow you in 25 at a time or so. Is that a big protection? Do you see that being a value?
Maintaining physical distance is one of the tools we have in the toolbox to decrease transmission. So to get COVID-19, to have transmit this SARS-CoV-2, this is the name of the virus. It requires someone to have the virus, be infected with the virus, and then it requires that close contact, or that person has spread the virus onto a surface, and we touch that surface with our hands, and we then touch our face, and we get the virus through our mucous membranes in our eyes, nose, and mouth. That's how you get sick. So maintaining that physical distance, and everyone's calling it social distance, it's actually physical distance between people, will decrease the risk of transmission. What I'm learning though, Jeff, again, in the supermarket that I was called out to, it was 11 o'clock at night. 2 of the workers had just been lab diagnosed with COVID-19, and the mayor here in the area where the supermarket was very worried if that news got out publicly, and it eventually did. Sure. What would be the reaction from the community? So we were called in to do a risk assessment. We did our risk assessment. Where did they work? How long have they been working there? How are the other employees feeling? Then we came up with a plan based on the floor plan, the design of the grocery store, of how to clean and disinfect. And this is what I'm really challenged with at the moment. The terms deep clean, or hospitals use terminal clean, haven't been well defined. And what we're doing in the clean industry now is actually putting more specificity, more details into what is a deep clean or a terminal clean, knowing that those cleaning and disinfecting practices that go together, because you can't disinfect a dirty surface, you have to clean it first before you use an EPA registered disinfectant, actually then has the best chance of using the chemistry of the product in the disinfectant to inactivate or kill the virus and decrease the amount of virus. And we came up with a plan. And the supermarket was closed for one day. We looked at it, we went through the plan, we reviewed the plan. I observed the cleaning professionals actually clean the grocery store. And by the next day, we believed that we'd been pretty successful. We didn't have the ability to test, which would have been ideal. But we then opened the supermarket after it was closed for 36 hours.
Very nice, good to hear. I like that, physical distancing as a phrase rather than social, because I got to tell you, when you're around people, it's not very social at all. You're walking down an aisle and someone sees you coming, they're like, oh, they're playing football or something. And I know when I go out for my run in the neighborhood, people will actually cross the street. I don't know if it's me or not, but that's what people are doing. They're scared. They're scared of what's going on. A couple more questions, then we'll let you go. I know you got probably a hospital to visit today. If you could peer into the future, what do you see short-term and long-term? Like, do you see us coming out of this soon? I know it's a guess, maybe an educated guess for you, but what do you see happening?
Again, history's shown us, Jeff, for any disaster, whether it be a natural disaster, a man-made disaster, or an infectious disease outbreak, and I worked extensively in West Africa for Ebola in 2014, every disaster has a start and an end, and then we have to recover. I'm not sure, when this recovery part starts. Hopefully that it will start soon. But what I'm seeing at the community level, the neighbourhood level, the resilience of people, neighbours helping neighbours is really impressive. The way that we're helping those, even in my neighbourhood now, we have at least 6 patients that have been diagnosed with COVID-19. I know when I talk to them from the sidewalk, or I talk to them on the cell phone, because we have these wonderful technologies to keep things social, keep us in contact, they're not doing well. This disease really knocks you off your feet. They're stuck in bed. So the neighbours are coming together, buying groceries, getting medical prescriptions, and any other errands they need to run. The other thing I'm concerned about that I hope will change for the cleaning professionals is that, yes, I've seen within some hospitals, not all hospitals, the cleaning professional staff have a seat at the table within the hospital incident command system. This week's been a bad week. This has been a really tough week. We've seen a number of nursing homes, assisted living facilities. We had one nursing home in a state the other day where 155 of the residents and staff were diagnosed with COVID-19, with the coronavirus disease, and they were sick with symptoms. The governor of that state got on TV and made a statement. We are sending the professional cleaning crews in to clean and disinfect that building. No, don't do that. Because the viral load, after you've taken out 155 people with COVID-19, the viral load in that building is enormous. It's huge. The best thing you can do is close the doors for a week and then wait for that viral load to decrease, then send the teams in with the right equipment that they've been fitted for, tested for, they know how to put on and take off safely, and send them in with the right equipment and the right EPA registered disinfectants. And I'm seeing this as an afterthought. Every time there's something happening in a grocery store, a nursing home, an assisted living, or even in the hospital, the knee-jerk reaction is, don't worry, we'll just send in the professional cleaners, without any thought of, have we done our risk assessment first before we put the professional cleaners, which are essential employees and part of the frontline worker community when it comes to beating this coronavirus disease?
So that's a scary situation. We think of a nursing home with that kind of an issue. Are they following these procedures and protocols you're talking about? Is it happening, or are we missing the opportunity to do it right?
We are learning and we're getting better, Jeff.
Okay.
You know, that when we saw, and myself and other colleagues saw that on the news, we scrambled, we picked up the phones, we sent emails, text messages, phone calls. Don't do this. This is too high risk. Stop. And it did. It was delayed, and that's what should be done. But it shouldn't take us going to a chaotic situation, an emergency situation, to try to prevent risk to professional cleaners. What we should be doing in every situation, look at the floor plan of the building. Set up your zones. Where is my green clean zone? Where's my transition yellow zone? Where's the red hot zone where the virus is? Plan before you go in. Practice, drill, rehearse before you go in. And then work out from a risk assessment whether it's better to just close the doors for a few days or even a week before you go and let the virus actually inactivate, be killed and decrease the viral load, or you need to go in now because that building's or that patient room's going to be used within the next hour. And these are decisions we're not making as well as we should be. People are still struggling. What is a risk assessment? How to identify hazards? And I think that's something that all of us within the cleaning industry can do much better with, but we have people within the profession that can teach, educate, as well as assist with doing that better.
So I know that everyone's trying, and the GBAC team, which you're part of, you have a lot of experts on your in that group, and you're all busy. So thank you for all you're doing and helping with that. One more question. So we've heard on the news, now we're in this right now and we're dealing with it, and we want to be done. We want to leave our house and go back. We want to go to the movies and go back to the restaurants. We want life to be normal. Some are saying that this could happen again in the fall. There could be a reemergence of this. Any thoughts on that?
Yeah, so what we're looking at, there's been a lot of talk, Jeff, about what happens with the summer months, the high temperature, the humidity. At the moment, to be honest, we don't know. This disease is spread by close contact with someone ill with symptoms that spreads the virus. It's also spread by touching surfaces where the virus is still active and putting those hands on your face, and the virus gets through your mucous membranes, your eyes, your nose, your mouth. If that continues to happen, if we don't maintain physical distance, if we don't do something that can break the transmission of the virus, and this is why I'm very encouraged when I see at the community neighborhood level where people are saying, yes, we don't want the virus to come into our neighborhood, and these are the measures we're doing. We could do better contact tracing. We're not doing enough of that at the public health level. That's something that we could do. But we could also then, as I said, neighbors helping neighbors to get through this so we can get back to our normal day-to-day lives. How long this goes for, it depends on how much contact we all have with each other, and that will keep that virus being transmitted continuously. I would not rely on a change of season. I would not rely on a change of temperature or humidity at the moment. It's all about contact between people, contact with objects that are contaminated with the virus.
So a lot of unknowns, but we do know that we control some of it, it sounds like, with how we live our lives and keep our distance and clean. Cleaning is important.
Theoretically, if we could stop all movement, which we can't theoretically, this could be over within a couple of weeks. But in the real world, theoretically, people, or practically, people have to move. Things have to move. Objects have to move. People have to go and do their work, and they have to go and buy make essential trips for groceries and medical prescriptions, and go to work and do other things as well. So while that happens, we have to maintain our physical distance. I would also emphasize to anyone in the cleaning industry, as this is what I tell everyone in the hospitals, make sure you have outdoor clothes and indoor clothes. The indoor clothes always stay indoors. The outdoor clothes never come indoors. They're the clothes you wear outside. When you come home to your home, have an entry zone where you change out of your outdoor clothes, including your shoes, into your indoor clothes, and then you put those outdoor clothes straight into the laundry to wash them, and do that every day.
That's great advice. We have a lot of cleaners out there in homes, in buildings. They're doing their cleaning, they're applying their disinfectants, and they might not go that far as protecting themselves and their families. So hopefully those that are watching this change their habits and have indoor clothes and outdoor clothes. Well, I appreciate your time, Dr. Gavin Macgregor Skinner. Good to talk to you, and keep up your work with GBAC. And let's do this again sometime. Maybe in a week or two, there'll be more news to talk about and consider in this edition of Straight Talk.
You're very welcome, Jeff.
All right. Have a good Saturday.
Bye now.